is Tracy with the Oasis for Natural Healing. I am, well, I don't see that this is actually going on Instagram, which is kind of a pain in my arse. I don't think that this actually connected. Anyway, that sucks. Okay, I am so not tech savvy. Anyway, I'm on late. Partly, well, two things. Again, I'm not tech savvy. I locked myself out of the restream a couple times, and I had to wait several minutes to get logged back on. And I don't think I am actually on live. So yeah, this is not working. So I am going to jump on my phone real quick. So that way, okay. Doot, doot, doot. All right. Anyway, so all right. So now we are definitely streaming from both Facebook, YouTube, and Instagram. All right. So tonight I want to, and again, sorry for being so late. I locked myself out of my Restream account. Fun times. Tonight I kind of want to talk to you guys about choices and holistic health. What I do and what a lot of other holistic practitioners do, we go against the mainstream media, and in some cases, it is looked down upon almost from even other family members. And you might get laughed at. You might even have other family members get very mad at you for going the alternative route. And it's very difficult, especially when you don't want to cause waves within the family members or within your house or whatever. And most of us are people pleasers. We don't want to cause waves. Even if we feel like something is good for us, we don't want to disrupt the apples in the apple cart. And it's very, very sad. I actually had someone, elderly person, called up very, 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 very anxious to the point where I could feel the anxiety jumping from the phone. And went through the whole medical gamut, was already on a couple of psych prescription meds. Nothing was working. Slightly elderly woman. Um, and begged me to get her in for an appointment. And I actually rearranged some of my patients. I asked them first, obviously, but I had some gaps where, like, okay, I had like a couple minutes here in between these patients and a couple minutes here. Well, if I move this person up and move this person up, then I could squeeze this new person in for a consultation. So, and I got her in for a consultation, sooner rather than later, because she was actually later, but she kept calling and calling and calling, seeing if I had anything sooner. So I did. I made it happen because, I just I felt so bad for her. I've been to the point where you just literally feel like you're gonna jump out of your skin. And it's so uncomfortable and it sucks to feel like that. And so I rearranged, was able to squeeze her in sooner rather than later. And I tell all of my patients this. You have got to give your body time to heal. You didn't get like this overnight. It's going to take some time. Now, what I think I do is pretty darn miraculous. It is pretty darn amazing. I mean, for the most part, I was a cardiac ICU nurse and I'm a family nurse practitioner, and I don't really practice Western medicine pretty anymore. I'm primarily doing holistic health. That's how much I actually believe in what I'm doing. And you better believe in what you're doing, otherwise you shouldn't be doing it. That's just really the truth. If you don't believe in what you're doing, you shouldn't be doing it. You shouldn't be practicing it. You shouldn't be a patient or you shouldn't be a practitioner. So I believe in what I'm doing so much that I pretty much almost only do this. I don't really do family medicine. I can prescribe meds. I'm a completely independent nurse practitioner. I'm state licensed, board certified, but I really don't do Western medicine anymore because I find that this helps people out so much. I've been doing this for 9 years. Anyway, so and most of my patients have anywhere from a 25 to 50% improvement of their overall symptoms in just 3 months. That's pretty significant. Can you imagine feeling 25 to 50% better? And I have more patients over 50% than under 25%. But you've got to give me 3 months minimum, because we're not even going to be fully healed at the end of 3 months. I'm just talking 25 to 50% improvement. There's still an extra anywhere from 75 to 50% still left to heal. But that's a big improvement in just 3 months. So to kind of go in and say, well, I'm just going to try this out for a month and see what happens. No, you can't do that. You took a while to get like this because I'm sure your check engine lights were going off for a while before you called me. And that's usually what happens. Most people wait till their symptoms are so out of control and they've gone the Western medicine testing, they've done all the testing, they've seen all the doctors, and nobody can fix it. Or they're just saying status quo, or they're getting worse. And they're tired of being on medication. They're tired of the side effects from the medication and needing more medications to handle the side effects. Then they finally come to see me. Well, then I have a whole hot mess to clean up. And I think what I do is pretty miraculous. But last time I checked, I don't walk on water. And in fact, the last time I tried, I fall through. The only person that I know that walked on water and actually did it lived 2,000 years ago. And that sure as heck is not me. So while I like to think of what I do as pretty miraculous, it's still going to take time, not instantaneous healing. So with a program with me, you have got to give yourself time. And if you can't do that, then you shouldn't be starting with me at all. And I let all of my patients know this. So going back to this, and this really, really saddens me. This actually really, really saddens me. So this person comes and is begging me. She's literally just got the supplements this past weekend. And apparently, a family member of hers is not on board. I don't know the full conversation, didn't really ask. I mean, and this patient was calling me before the supplements, even on my days off, and I was actually walking her through some things just to keep her calm until some of the supplements came in. She didn't wanna go back to her doctor or anything like that because she was already on meds and they weren't helping, but she literally was beside herself. So, I get a phone call saying that she wants to cancel the program. I'm dumbfounded. I'm literally dumbfounded. And I come out to find out that it's because her family member is giving her a horrible time about trying something holistic, and somebody who's out of state and not even in the same state as her. I guess this person would not even look at my website and was berating his family member for doing something holistic and alternative. to the point where she wanted to quit. And of course, I know that this can help. I've seen it with myself. I've been able to come off of 3 psych meds. I see it with my patients all the time. I know that this can help. And so I get on the phone with her and I'm talking to her, and it was really all about her family member giving her a bad time about doing this. And one of the things that I want to stress to you, nobody, and I said this to her and I'm saying this to you guys, nobody lives in your shoes. Everybody can have pardon my French, everybody has an opinion, and opinions are like assholes. Everybody has one. You have to do what's good for you. And yes, that might mean making some people mad, but nobody else has to live in your skin except for you. People might not understand. People might get angry. But what is best for you? And when you're a better version of yourself, doesn't that mean you're going to be better for everybody else around you? They might not understand what you're doing. They might even get upset with you. But let me ask you this. Is what you're doing right now working for you? If it is, great. If it's not, then it's time to look for something different. And it might not be me, right? It could be something else. It could be yoga. It could be Tai Chi. It could be doing energy healing. It could be, I don't know, whatever it is. And people might not understand what you're doing, but do you have the courage to do what you need to do for yourself? Do you have that courage? Are you worth it? Are you worth the fight? That's one of the things that I think I want to stress to people. Are you worth going through things for yourself, not for anybody else? Because guess what? There's only one of you. Oops. And I have a low battery. There's only one of you. Nobody else knows exactly what you're going through. I might be able to relate to you, but I do not, and nor does anybody else have that experience. Your experience is unique to yourself. And no one has the right to dictate on what you should be doing for yourself and what you feel is necessary. And if they do you have what it takes to stand up for yourself? Even if it's difficult, are you worth the fight? And it gets difficult. I understand that. And this is one of the things that I maybe not in those exact words, but I tried stressing to this patient, and I asked, "Do you remember when you first called me a couple weeks ago begging me to take you on and how miserable you were?" And she said, "Yes." And I said, "Are the doctors helping you?" And she said, "No." I said, "Okay, do you have a plan of what to do if you stop care with me?" And she said, "No." And I said, "So what are you gonna do?" And she goes, "I don't know, but blah, blah, blah is giving me a bad time." And she was so consumed about what her family member was going to say and do that I actually had to let her go because I can't help her. As much as I want to help her, I can't because she was too overwhelmed, and he wouldn't talk. He wouldn't even look at my website nor get in touch with me. And I really hope to God that she finds the help that she needs. And it kind of actually saddens me, but she couldn't let the fact go that her family member was so upset with her, and she was not willing to give this a full 3 months. And she started saying other things too, like, "Well, I can just try this for a month." I said, "No." I said, You've been like this for years. This is not a like, okay, we're gonna see how this works. After a month, then we can quit. This is this is gonna take some time." And I really wish and I really was hoping that she would stick in. And I kinda guess I'm putting this message out there so and hoping that you guys do things for yourself and don't let anybody else dictate what's best for you. And please give yourself the chance and the time that your body needs to heal. It's difficult because we get so impatient or we want that instantaneous fix. And like I said, I wish I could do that. I wish I turned around and I wish I had that magic wand and could go poof and like make everybody all better. I haven't figured out how to do that, at least not instantaneous. With me, it's at least 3 months, but hey, to feel 25 to 50% better in 3 months, I think that's still a pretty good fair shot. Don't you? Anyway, I see that some people have hopped on. It was probably at the last minute, and I'm glad that you guys were here. I highly encourage you guys to rewatch. I guess tonight was just really about talking to, um, or I guess standing up for what you feel is best for you and not letting anybody else dictate, what's good for you. Because again, there's only one of you. And sometimes those roads are very, very difficult to make, or those decisions are difficult to make, especially when you have other people turning around and not agreeing with your decisions. It does cause some rocky, some waves, within the family dynamics or with the friends or whatever. But if you truly believe in what you're doing for yourself, you're worth it. And don't let anybody ever dictate that and tell you what to do, especially when you are only the one that's going through things. Nobody else is in your shoes. No one. Not one single person is going through like I said before, they might be able to relate to what you're going through, but they don't have the same exact experience as you. So they have no right to dictate on what's best for you. Only you can answer that. If you guys or if you know of anybody who has gone through different types of testing, different types of whatever, and you're not sure where else to turn, or you don't seem to have the answers that you're looking for, and you're looking for an alternative route, please look up quantum nutrition testing. You can give me a call. If you want more information, like I said, we have about a 25 to 50% improvement of overall symptoms in just 3 months, but you got to give this time. It's not an overnight fix. This is not some sort of band aid that we're trying to put on. So it does take time. We've helped out so many people, anywhere from infants to elderly people with multiple things: chronic pain, fatigue, anxiety, depression, blood pressure issues, gut issues, skin problems, um, just a ton of different things. So if this is something that you might be interested, or you know that somebody is possibly looking for a different way to get better, please have them reach out 708-554-6730. Have a wonderful night, guys. Bye.